Hello, my dear students, everybody here. I am Dr. Anshul Divakar, your anesthesia faculty, and today I'm here to have a conversation with this wonderful girl who I have spoken to few times before, Dr. Namrata Panja, and she's somebody whom I wanted to talk about despite the results having come out long back, and now the counselings are going on, and now we have the next year's uh, exam in sight, but somehow she was very shy, so we couldn't find her. And I'm very happy to introduce Dr. Namrata to you, who has scored a wonderful rank of 169 in NEET PG 2024. But what is more important, and I want to tell you all this thing, is she is an undergraduate from Calcutta Medical College 2017 batch. And in her internship year, she scored a rank of 5,000. She opted not to go for a seat. Then in November INICET, she got a rank of 450, which was again something where she was getting most of the things. But again, she did not take up the seat. And we had a conversation about what to do. And she only told me that she's somebody who feels that she can do better. And then NEET 2024, she did an amazing job of 169. So I welcome you, Dr. Namrata.
Thank you so much, sir. It's a pleasure to talk to you and give this interview.
The pleasure is all ours, actually,
Thank you.
because you go through this entire journey, and then when you come back and when you talk, it feels like we have achieved something. So actually,
Yes.
it's a pleasure for us to be talking to you. How are you feeling?
And
Although now the feeling must have sunk in very well, and now you are at the brink of starting your post graduation. But how
yes.
does it feel?
So, it still feels great. And it's still, it's difficult to still believe it, that it's actually true. All the hard work and all the doubt and everything actually paid off. It's just, I'm so grateful for it, really.
Yeah. So what I want to focus today here, Dr. Namrata, is I want basically you to share the ups. Of course, you have gone through a lot of ups. You must have done a lot of tests and everything. But we also want to focus on what were the downs in your process and how
Yes.
difficult was it to be some place where you are getting a seat, although not the seat of your choice, to leave that, to have that conviction that despite of having a four-figure rank in NEET and a three-figure rank in INICET, both of which were gettable, still wanting to try and attempt a good attempt where you felt that you would have given your best. So take us through your journey.
So firstly, I joined the foundation course in DAM. So I had a base where I had prepared, mainly in third year, I had made my notes because that was the COVID time. So I was lucky to get that time. And during final year and internship, my preparation wasn't that much. I wasn't so much focused on NEET. I was really focused during internship on doing my duties and really learning like the hands-on basically in our college. And our college provided a lot of exposure. So I was more focused on that. And when I got time to study, like during our community medicine postings, that's when I was studying for the PG exam. And then, I did not go into the NEET PG that year, like 2023, with a lot of expectations. But I think it was a relatively easy paper, and luckily I got a rank of 5,000. But then, I was quite sure that I was not going to take a seat with this rank. Because, firstly, I felt that I could do better. I had put in maybe 30 to 40% of what I felt I was capable of in NEET 2023. So naturally, I wanted to do better, and a lot of people around me, a lot of really good students who've cracked before. I mean, some of them really motivated me that I should try for INICET, or I should try for bigger things. I'm capable of it, and also like the branches which I had in my mind. Dermatology was always like in my mind, but I didn't allow myself to believe that it would actually be possible to achieve. So, just all that was going on in my head. And with that, I started my journey after internship. That was when I seriously began to prepare for the upcoming exams. So after that, so the first 6 months up till November INICET was quite smooth. I was somehow, for some reason, I was feeling quite confident that, okay, during internship, I have a good base. I've prepared my notes and all are prepared. I've done some revision of major subjects during internship. So it was going smooth. And like just before November INICET, I don't, right now it might seem a little delusional to me, but I felt that I should absolutely get a top 50 or top 100 rank. I mean, that was, for some reason, that was my mindset that time. So when I got a rank of 452, I was actually very disappointed. I just felt that, I mean, not to sound ungrateful or something, but then I just felt that, it did
So
not meet my
this must be
expectation.
based on your performance in your GTs and CBTs. You must not be just feeling it. There
Hmm.
must be a base to it. You must have done good in your CBTs and your
Yes, sir.
GTs and the tests that you must be giving. You must be consistently scoring good in that. So it must have
Right.
felt if I'm doing good in them, then of course I'm supposed to do good in exam as well.
Yes, sir. Actually, that reminds me that GTs, they were like, I was improving in them. And I mean, there was a bit of, like, what do you call that, plateau. But then it got better. I felt I was scoring well. And the CBT, the INICET CBT, which happened, I think, 2 weeks before November INICET 2023, I had actually got a CBT rank of 5. So I
Hmm.
think that definitely
Yeah, that definitely
played.
boosts your confidence, definitely.
Yes, I mean, that kind of shaped my psyche, even though I knew that obviously there are many students who don't appear for the CBT or they don't give their best and all that is there. But I mean, that kind of warped my mindset. And I was also really stressed on the day of the exam. So all this combined, I mean, still 452, I mean, it's a good rank, but then
Yeah.
I was not
For most of
on.
the people, it's a very good rank.
Yes, and also INICET has the problem that there are not many seats. So that
Especially
also,
derma is very less.
yes,
Mm, mm.
it is. So
So
after that,
that's
yes,
when we spoke where you said, what should I do and should I take up anesthesia? And
yes, sir.
I think I didn't get a chance to answer you. You yourself said ki no sir, I'll probably try for NEET.
Yes.
Yeah.
So I think that was when I was like after the exam and after the result, I was just kind of doing research because I mean it is a really stressful juncture to be at. I mean I'd heard people like seniors who've cracked talk about it, but when you're in that position, you really realize how difficult it is when you feel like there are two paths ahead of you. One is to take up what you're getting now, and one is to just go on this very arduous journey of preparation. So I was very much, I mean, I was very confused and very stressed at that time. And I think I started researching anesthesia. I watched your career counseling video, and then that's when I messaged you the further doubts I had. And then ultimately, I think I told you that I was really confused whether to go for anesthesia or take up derma. And I mean, yes, I didn't tell you after that that I was planning to go ahead with the preparation phase, but that's what I decided. Around December, I was quite certain that I would not be sitting for the counseling in November in INICET, and I would keep on preparing.
Did you have any idea in the month of December when you decided not to sit for the counseling that there'll be so many delays and then postponements and preponements and then again postponements for the exam?
So honestly, I mean, if I knew that this would happen during the counseling, I would not have taken this chance of preparing. Like, I mean, I would have definitely.
It's almost more than a year since you had November INI and you could have
Yes,
started your post graduation in December of 2023 and now we are
yes,
sitting in December of 2024 and there is still
yes,
nothing in sight. Like now you will start probably in a month or so, but
yes,
yeah, it has been delayed a lot.
yes. So, I
How did
mean,
you go about that preparation after? Tell us little bit about the way you prepared, how you approached your subjects, and because you had the base of
right,
your notes, but then what you did after
yes.
that? Once you had the
So,
notes with you, then what
yes.
did you do with them?
So, during my November INICET preparation phase, the pros, I mean, the good things which I did is I revised multiple times because I mean, the first read like during the gap year was about 2.5 months. And then I just kept reading the notes and then doing retrograde revision after giving GTs, or I would give subject tests and TNDs and kind of do retrograde from there. But I think the mistake I made during that time, other than my mindset going into the exam where I was very stressed and all, was that I focused too much on retrograde revision. Now, so what I felt the problem with that is that the questions after a point of time when you've solved a lot of them, they become repetitive or from certain topics. But the people setting the real exams, they don't approach it that way, which is what I realized that, like say you have a topic in biochem, like glycogen storage disorders, just for example. So the questions in GTs would maybe be repetitively from von Gerke's disease, but then there are many more diseases which actually come up in the real exam. You think that, oh, in the GTs it's just von Gerke's, let me focus on that, but then actually that's not what happens. So that was something which I altered in my preparation after November INICET, where I focused more on like reading my notes rather than doing too much retrograde revision. I mean, both sides are important, but I think notes is like, I mean, it's gold. It's
Gold
what is
standard.
actually, yes. I mean, main notes, there is absolutely no substitute for main notes. No revision course, no nothing. I mean, main notes and clinical exposure. I think these two are the most important things. I mean, there's no way that these can be replaced. So
And
that
that you must
was,
have
yes.
had very well, because in West Bengal anyway the internship and clinical exposures are just too good.
Yes, sir.
It's like a thing. You guys do internship because you want to do it. So
Yes, sir.
I meet a lot of West Bengal students and they are all very good at what they do because the 1 year they are happy doing the internship.
Yes, so that was absolutely, and I knew that that 1 year wouldn't come back. I
Yeah.
wouldn't get that year back. So that's why I was also focused on that. And yeah, so these two combined, I mean, so that's what like I focused after November INI when I began again in December, that I should keep reading my main notes a lot. And of course, tests are a very important part, but then I should not do too much retrograde just from those topics. It should not become that selective. That was my
And
main aim.
how did you handle the postponements of the exam? Because I think the
So
original exam was slated to happen in March.
yes,
Then from March it went to June
oh
to
yes, no,
July.
July and then
July. Then
June,
July to June and then June to August.
August.
Yeah.
So
How did you handle that and what changed? What did you change when there was a postponement? What you
yes.
changed when there was a preponement, and what happened to you on the day when you were prepared that next day there will be an exam and overnight it got postponed?
So I mean, long story short, it was horrible. The whole phase. I mean, I'm not going to sugarcoat it. I think it's important for people to know that it's not always very easy and all that. And I remember, sir, you had made a video. I think it was like a discussion video on YouTube where you said that the people who are going to do well in the exam, they don't know when they're preparing that they're going to do well. They have no idea. They're just as stressed and
Yeah.
overthinking and everything as anybody else is. And that was totally the case for me. I mean, really, like I would not have imagined that a top 200 rank was possible in NEET. So
Yeah, I mean,
that's
there's
very
a general
important.
perception that people in the top 500,000 in all India, they have a halo around them and they are, 1 inch above the ground, and that is what all the students they feel. But after talking to
Yes.
so many of you, I realize you have the same beliefs, you have the same insecurities, and in fact,
Yes.
you probably would be thinking more about your shortcomings than somebody who is not so well prepared, because somewhere more knowledge, more confusion kind of a picture comes. Little
Yes,
less
sir.
knowledge, less confusion, more confidence kind of a thing comes. And I
Yes,
know
sir.
that one thing that I always felt different uh, between somebody who is just preparing and somebody who wants to achieve and get the best result, irrespective of what they want, is that they're never satisfied. So even if, like you
Yes.
said, I'm sure you must have given the INICET CBT 2 weeks before the NEET and gotten a rank of 5, but that would have not deterred you to stop reading before the exam. You would have
Yes.
still gone back to your mistakes. You would have still, and you would have done the same thing even after the rank of 450. Ki, nahi, I have to again go back and I have to do the same
Yes.
thing. So that
Yes.
dissatisfaction with the preparation, I feel, is the key,
Yes, sir.
because the
I
more
mean,
dissatisfied you are while you are preparing, the more you leave on
yes.
chance, and the more you get the things done in your mind before the exam.
Yes, sir. So, sir, January when the first postponement happened, I mean, I think I took that very badly. I didn't take the further changes that much badly. Like that really stressed me out in January. So January, February, March, April, my preparation, I mean, I was studying consistently every day, but it wasn't, I mean, now looking back, I feel there was something lacking. I mean, it's like I was doing it very mechanically and not actually putting enough like mind or enough heart into it, so to speak. Like it was just very mechanical and maybe things were not going into my head. And I mean, I was doing what everyone is supposed to do, like you reading, you're giving your tests and all that, but I wasn't actually improving. And then when May NEET happened, that was the real the shocker or the like it changed a lot of things because I did not do well at all in May NEET. I mean, I had a rank of 452 in November, and from that I went to 1,000 in May NEET. So I mean that was probably the worst day during this whole preparation phase when that result came out, and that changed a lot of things. So, like
So,
what
but do you
happened?
think
Yes,
but do you think in retrospect, you not putting too much of effort in those 4 months kind of helped you in the fact that the next 4 months you had that, because I feel there is only enough fuel for anyone to prepare intensely. And I think 4 months is what they have in them. Most of the students can, really study very hard for 4 months. And
yes,
although your journey is for about an year, but ultimately it all comes down to those 4 months before the exam. And a lot of
yes, sir.
students, I feel they do this thing that they initially put a lot of efforts, then they get tired, exhausted. And
Yes,
because
sir.
initial months, even if you put a lot of efforts, it doesn't really reflect too much on the tests. And you kind of don't know where you are going. So it's all shooting in the
Yes,
dark. You only have a conviction that, okay, I'm reading subjects and I'm doing some tests and I'm doing GTs. But you kind of get the hang of things about a month before the exam when you start
yes,
spontaneously getting answers correct. Even if you're flipping a GT that you have done before, you're like, हाँ ये भी आता है, ये भी आता है, ये भी आता है.
yes,
I
right,
think
sir.
in a way that was a good thing that happened to you because a lot of people got
Yes,
exhausted just before the exam. July
yes.
was
In
not a very good
retrospect,
month for most of the students.
right, sir. In retrospect, definitely. I mean that turning point, that mini set going badly was important for my NEET result. So yes, ultimately things did work out.
So,
So
but
yes,
one thing stands out, which I like to point out, is that every exam kind of helped you either to move ahead or to go back and check. So it's like
yes,
you're very lucky that after internship you had November INI, which propelled you to do better in NEET, and then there was a
yes,
May INI, which made you realize that the road is still a long way.
yes, sir,
One helped you
absolutely.
take a decision of going ahead for the branch that you want. And one made
Yes.
you realize that, okay, even if you have taken that decision, ultimately the job needs to be done.
Yes, sir. I mean, that
So,
is true. They were really very important. I mean, they were teaching points basically, both
so
the
basically, we can
exams.
treat INICET as a very good CBT. I
Yes, sir,
often tell students that
absolutely.
is one of the best CBTs you can have, where the
Absolutely.
exam feel is exactly the same, and you go to
Yes.
an official center and you sit, and then you get an all India result as well.
Yes, sir.
If you are in the top,
Absolutely.
if you are in top 100, then fine. You just leave this entire thing, go and take a seat in names. But then ultimately, even if you are 500 or 5,000, it helps you understand your preparation. And
Yes, sir.
now also they have just announced the date, so it is going to happen a month
Yes.
after INI. So it
Yes,
kind
yes,
of
in
falls
June.
in place, right? Just a month before you have this very good idea where you are standing, which is a very good thing.
Yes, sir. It really is. And even I tell any of my juniors if they ask me, sometimes they say this thing that we don't feel very prepared, we don't want to give the exam. It feels like they'll demotivate us. But
Yeah.
the advice I have got from my seniors is it doesn't matter. I mean, you just have to give the exam because it's a whole different ball game sitting for a real paper. So irrespective of preparation, one shouldn't shy away from sitting for the exams. Like INICET, maybe a lot of people don't target INICET, they want to target NEET, but giving INICET seriously is instrumental to doing well in NEET. So,
Right. So, Namrata, now I'm going to ask you some boring questions. Like you said you were a student of DAMS Foundation course. So you
yes,
have done all the regular classes. So you have the classes, you have the notes, you have the videos, you have the class test, subject-wise test, you have GTs, CBTs, you have all the other short courses like INICET, Predictor series or the PYQ ka Baap series. So if I have to
yes.
understand that out of the buffet that we offer you, what you consider as the most important things or the must do things from the pool of everything, what would you point at?
So firstly, of course, the regular classes, the regular notes, I mean, that is the most important thing. And I think the CBT and the TND, I mean, for me, if I had to choose three, then I would say these three, like
Okay.
the main classes, the TND and the CBT. I think these were, I mean,
You
absolutely,
you you are a
yes.
very positive person because I've never seen any student talk good about CBTs. Uh, because they keep complaining that the paper was very tough and we did this and we did that. But
Yes,
yeah, even I feel that CBT is by far one of, and we give a lot of them. Like for each
yes,
exam, we have about 3 to 5 CBTs and 2 mocks, and
yes,
and all of them are very thoroughly prepared. I know because we have a theme in which we want to design the paper so that it gives you the best feel of the exam. Of course,
yes,
little touch more difficult than the real exam, uh,
yes, sir.
but then it's for everyone, so it kind of doesn't feel that way.
And
Ultimately,
also, yes, I mean, it's very indicative of how well we'll do because the CBT which I gave before NEET, this NEET, I got exactly 173 correct. And even in my real exam, I got exactly
170.
173 correct. So, I mean, it
And
was
it's a
quite
very,
an
yeah, it's a
indicator.
very good mirror in the preparation, a
Yes,
month, 2 months before the exam.
yes,
So
sir.
that is something very good. Nice. So finally, we are coming to what you are going to do now. You are going to be a great dermatologist. You have taken up a seat in, I think, LHMC.
Yes, Lady Hardin's for now.
Perfect. Heartiest congratulations. You're going for an
Thank
upgrade or
you.
you're going to continue there?
I have opted for upgradation, but I mean, I've not really looked at the choices yet for second counseling. I will be
Okay.
doing that.
So you'll just
So,
like kind of, okay, let's give it a try. Otherwise,
yes, but I mean, otherwise, I'm very happy
yeah.
with where I've got.
No, even we are very happy. Now we know one
Thank you,
great
sir.
dermatologist in Delhi. So if we have any needs, we'll definitely contact you. Any
Thank
last words of
you. Yes,
wisdom that you want to give your batchmates or juniors who are preparing for this June? We are in
yes,
December. They have exactly
yes.
6 months in front of them. So what advice would you want to give them?
So one last thing I would like to say, I mean, everybody knows now about reading notes, GT, CBT. I mean, everybody knows that, but I think what really shaped my preparation just before NEET, 2, 3 weeks, and what really made the difference was to give the exam, I mean, very mindfully, because sometimes what happens is, at least in my case, I was afraid of overthinking. So I would kind of like glaze through the questions or go with my first instinct. And that is important, of course, but it's very important to really read the question properly and really be mindful and be like, okay, these are the clues. I should not miss any point and just attempt it with full concentration. I think, I mean, that really changed things for me. And that is something people maybe don't focus on that much. I mean, they think about the preparation and not about the exam day. So having full concentration on exam day and just reading every question, even if it seems very easy or it's like a short question or you feel that it's from a topic you know, like that mindfulness is key. I mean, I think people don't focus on that so much. At least I didn't till the last moment. So
And
that's why.
so how did you prepare for this mindfulness? Did you do anything extra?
So I think there were some free mini tests on the DAMS app, which was before, just that 1 month before NEET.
Yeah.
And a lot of DAMS faculty conducted Telegram quizzes regularly.
Yeah. Yeah.
So these two, I mean, those I
So
would
giving
do with,
tests,
yes,
exposing yourself to the exam situations. And
yes, and
if you would have
maybe
attended
just,
my regular class, you would have remembered that I always talk about 50% of your rank is academic, but 50% is your presence in the exam.
Yes, absolutely, sir. I
If you're
think that
not
is what
present,
changed.
yes, if you're not present there, doesn't matter how much you prepared.
Yes,
So having a good night's sleep and being there with a positive mindset and wanting to read a question and not cursing yourself in the middle of the exam that what am I doing with my life and sort of a thing.
yes,
And just kind of spending those 3.5 hours with the questions and just making sure that you give 100% attention to them. Uh,
yes,
I think that makes a huge difference in the outcome that you are wanting to achieve, isn't it?
absolutely. So I'm not thinking about how the result will be and all that because
That is a
there's no
very,
point in that. I mean, it's
yeah.
difficult to not think about it, but the
So
focus should be entirely.
being in present.
Yes,
When
absolutely.
you are sitting in an exam hall,
Mm.
only thing that should be on your mind is the next question.
Yes,
Nothing else. What
ab-
happens after that and what will be the result and what will the Padosi say and how my life is going to turn. All those things should not come at that point of time. And that is the
absolutely.
only way you can be objective about these exams.
Yes,
So that is wonderful, wonderful. And I'm very happy that you said that mindfulness is very, very important. But I'll like to correct you on one thing. You said everybody knows the importance of reading the main notes and doing the tests and CBTs, but everybody knows it, but still they don't do it. That is the pity that we face. That although we have the holy grail of preparation in our hand, we
yes,
somehow ignore it the most. And that is something that I tell every student. And through this interview, I'm going to tell them again that
yeah,
ultimately you cannot build a building without the base, without the foundation, and foundation is your notes. So if you don't
absolutely.
have that, no amount of shortcut can help you go anywhere
Yes,
because ultimately you will forget stuff. It's
yes,
only your concepts, your base, your foundation of a subject that is going to help you understand that subject.
yes.
So, Namrata, it was wonderful to talk to you. Uh,
Thank you, sir.
we missed
Even I
you
was very
when
happy.
the exam results came, but
No, no.
I think in the middle of the session, it would be a refreshing thing for our students to have a understanding of this exam and what more importantly is the fallacies that even the toppers have and the insecurities that they have in their mind. And
Yes,
despite of all of that, you end up achieving a great result. That is something that we wanted to know from you. And we were very happy to
yes.
have this conversation.
Thank you,
And
sir. I was also very happy to
we
give
wish
this.
you a very, very, very bright future
Thank you
and
so
soon to
much.
see you.
Yes.
Okay.
Thank you so much,
Thank you
sir.
so much. Yeah. Good night. Bye.
Good night, sir.